Hello everyone, I am Dr. Mohit Kapoor. I am a first year radiology at AIIMS Bibinagar, Hyderabad, and today I will be presenting a clinical case with you. So, this is a case of a 55-year-old female presented with a chief complaint of pain and swelling in right wrist since 10 days. She has no history of similar complaint in past. She gives no history of trauma or surgery in past. She is not a known case of diabetes, hypertension, epilepsy, asthma, or tuberculosis. On general examination, her vitals, CVS, and respiratory examination was normal. However, on physical examination, we could see a 4 into 2 centimeter swelling on the lateral aspect of the right wrist. She was referred by the orthopedics department for an X-ray, ultrasound, or MRI. So coming to the radiological finding which we saw in this case. So first is the X-ray of the wrist. This was a AP view which was done on 27th of Jan 2023, and in this we can see a soft tissue swelling which was seen on the lateral aspect of radial styloid process, and we could see that it is also going around the lateral aspect of the scaphoid, trapezium, and trapezoid as much and going as much as till the base of first metacarpal. So this was a soft tissue swelling which we could notice on the X-ray, and the impression which we gave of this was a somewhat of a soft tissue swelling. So now the next the patient was referred for an ultrasound which was done on 28th of Jan 2023, and in this we could see a well-defined cystic or an anechoic lesion, and we could see that it was seen on the lateral aspect of the abductor pollicis longus tendon, and within the lesion we could see some internal echoes, and we could not see any septa within it. And I don't have a color Doppler image with me, but when we did color Doppler, we could not find any vascularity within it also. So the impression which we gave of this was most likely a ganglion cyst. The patient also had an MRI done on the same day. That was 28th of Jan 2023, and in this we could see a on this we could see first we should know that this is a T1 weighted image, this was a T2 weighted image, and this was a PDFS or a fat suppressed image. And in this we could see a well defined homogeneous lobulated lesion which appears hyperintense on T1, hyperintense or T2, and PDFS. I did not put more images of it, but there was one more image where we could also see septa within the lesion also. And as we will study later on, the septa are also very characteristically seen in ganglion cyst and MRI. So the disease which we should keep in our mind are ganglion cysts, and one very important disease is a tenosynovitis. Other than that, we will also keep in mind our GTC of abductor pollicis longus tendon and soft tissue sarcoma. So we should always keep in mind whenever we are thinking if a lesion could be ganglion cyst, a common DD is a tenosynovitis. And so I put an article on it which was published in American Journal of Rheumatology, and the heading of the article was how good is MRI for differentiating a ganglion cyst and a tenosynovitis in a patient having a chronic painful wrist. And the conclusion which they got from the article was initially they had 6 criteria included in it, in which first was signal intensity, second was the site, which was not found to be so useful as compared to the other 4, which was margins, shape, internal structure, and enhancement after administrative contrast material. And we could and they also said that the shape and the internal structure were the most helpful in differentiating a lesion to be a ganglion cyst or a tenosynovitis. I've also added the link of the article here. If you want, you can read it also. But in just I've also added the summary of the article, which was summary of the study which they did, and this was also in the article only. So here the features which their main features which they told about, and they have also used it to differentiate between a synovitis and a ganglion cyst, and as well as a dorsal occult ganglion cyst. So first feature was a margin, and we could see that in tenosynovitis we have somewhat of a diffuse margin, and we could see that it is somewhat of concentric shape and has a diffuse margin. Whereas in ganglion cyst we could see that it is a well defined uniloculated or multiloculated lesion, and so margin and shape we have done. Coming to site was not very specific to differentiate between synovitis or ganglion cyst, as synovitis are mostly seen in dorsal wrist, but ganglion cysts can be seen anywhere. Uh, However, dorsal occult ganglion cysts are more commonly seen near the wrist only. Size was also very important in differentiating all of them. And internal structure was also very important. Like we could see that in synovitis there is no septa seen. However, in ganglion cyst we can find septa, and as I told, in this case, in the patient also, those septa seen within it. Coming to the last point, which was enhancement after administration of contrast material, and we could see in synovitis we have a diffuse enhancement, whereas in ganglion cyst we have a wall enhancement, whereas a dorsal occult ganglion cyst can have a diffuse or a wall enhancement. So these were the features which I wanted to talk about a ganglion cyst. Thank you very much.